want to get into the why behind this mandate.
Yeah, the new rule is guided by science and what health leaders are learning about the virus. So we wanted to bring in Dr. Jeff Pothof from UW Health to better explain all of this. He's the Chief Quality Officer at UW Health. He's a graduate of UW Medical School of Medicine and Public Health. He did his residency at the University of Michigan Hospital and St. Joseph Mercy. And he's since served in many leadership positions at UW Health. He's also on the board of the Wisconsin chapter of the American College of Emergency Physicians.
All
while he continues to practice this morning. I'm sure I left a couple of things out, Doctor, but thank you for joining us this morning. First off, wanted to get your take on this mask mandate. Some people are criticizing it that it could be too little, too late. What's your overall take when it comes to the mask mandate?
Yeah, I think the mask mandate is a good idea. We tried to do this just by, asking people, telling people that's really important to wear a mask. And despite that, we still saw a surge in case numbers. So I think something a little harder, like a mask mandate, is a great idea for our community, because I think we all want to see those virus numbers go down. And we know that wearing a mask is one of the ways that we can do that.
So some people, Dr. Pothof, argue that masks don't work. I see this all the time on my social media feed. People are citing obscure studies, perhaps some conspiracy theories. How do you respond to that argument that masks simply don't protect you from coronavirus?
Yeah, I can understand the confusion. Early on in March, you can find clips of myself saying that if you're sick, you should wear a mask. If you feel fine, you shouldn't wear a mask. And coronavirus is interesting because we've been learning more about it as we go. And now we know that that guidance that we gave in March was wrong. It wasn't correct. We do know now with studies that there's a lot of people who have coronavirus that don't yet have symptoms, and 3 to 4 days before they start having any symptoms, they're going to be passing that virus off to other people. So it wasn't enough to say that you had to feel unwell to wear a mask, because we knew that people felt fine and were still giving the virus. The second thing that really changed our opinion on masks was we learned that you didn't have to necessarily cough or sneeze to create those droplets. Even just talking could create enough droplet to infect someone. So now we had a situation where you might feel fine, and just the mere act of talking could pass the virus to other people. That's where the mask mandate came from. The other reason that we learned is we didn't think that people who were healthy really received much benefit from wearing a mask. That's changed now too. There's new studies now that say even though the mask, the benefit is predominantly for those people who are going to get the disease, just don't have symptoms yet. We also know that it also has benefit for people who are completely healthy and giving them a chance and not catching it from someone who has the disease and maybe isn't masked near them.
Let's be transparent for a minute. There is a kind of a conspiracy theory out there that the health industry is in on this, and health leaders are in on this, and the media is in on this mandate to wear masks. Where are you getting your information from, and how do you use that to craft your message to the public? I mean, especially since this is like an evolving strain of the virus. I mean, like you said, what you knew a couple of months ago has evolved since then. So how do you go through the information and craft your message to the public?
Yeah, so really we use medical studies. So you can imagine there's thousands of researchers all around the world who are trying to better understand coronavirus right now. And that's where this information comes from. People do studies where they look at the virus and people who wear masks, people who don't wear masks, and, does the mask actually reduce transmission? And then they publish these studies so that the rest of the medical experts in the world can learn from them. And we actually take a pretty critical eye towards these studies because we want to make sure that we're not giving advice that's not true. But the preponderance of evidence now over the last several months has really shored up this idea that wearing a mask reduces transmission of the disease. This is really how science works, and it's one of the ways science works is we sometimes change our opinion based on new information. We don't just stick to something because we stuck to it in the first place. Things change as we learn more.
Important information, really important conversation to continue to have. Dr. Pothof, thanks for your time this morning.
You bet. Have a good morning, guys.
You too.